Uh, Assalamu alaikum. I'm Dr. Sijadur Rahman, Associate Professor Pediatrics. So far, we have discussed causes of anemia and then uh, also discussed the hemolytic anemia. Now, we are going to discuss one of the important hemolytic anemia, which is sickle cell anemia. So, uh, sickle cell anemia, as the name indicates, it's basically the RBC became sickled, and which then leads to uh, destruction of the RBCs, and then anemia occurs. So, most common abnormality of hemoglobin found in US, let's say about 8% of the black population suffer from this sickle cell anemia. And at birth, the incidence is 1 in 625 births. So important, and we should know the genetics. It's transmitted as an incomplete autosomal dominant trait. In zygotes, when there are two abnormal genes, there is no synthesis of HbA, hemoglobin A, and red cell contain almost 90 to 100% of the HbS, sickle cell hemoglobin. Heterozygotes, in which there is one abnormal gene, so the red cell contain only 20 to 40% of the hemoglobin, sickle cell hemoglobin. So, what is the basic pathophysiology? Uh, there is only a single amino acid substitution, valine for glutamic acid, in the beta polypeptide chain, uh, which results in sickle cell, which this the whole pathology surrounds around this change. Uh, the reason for the whole pathology, the reason for this um, whole sickle cell anemia is that valine is replaced in place of glutamic acid in the beta polypeptide chain. So HbS is less soluble than HbA. Um, Sickle cell hemoglobin is less soluble than hemoglobin A. Uh, Sickle cells are prematurely destroyed, causing hemolytic anemia because of their shape. And sickle cells results in increased blood viscosity and impaired blood flow and initiate thrombi. The different signs, which we will see in the later in the other slides, the different clinical features of the sickle cell anemia. In order to understand those features, you must know what is the basic pathophysiology of this disease. So, uh, because it causes increased blood viscosity and there is impaired blood flow and they initiate thrombi. So the whole you will know then the clinical feature. In the clinical features, you will see that there is different systems are involved because of this phenomena. So we will also look into the other slides in order to understand it. Uh, what are the clinical features? Uh, Basically, clinical features is anemia. There is moderate to severe normocytic, normochromic anemia. Uh, Normocytic means that normal shape of the RBCs, and normochromic, normal hemoglobin concentration. But there is reticulocytosis because of increased destruction of RBCs. Neutrophilia is common because they are prone to recurrent infections also. and platelets are often increased. Blood smear will show you the sickle cells. This is the you can see the normal RBCs and the sickled RBCs shown in the slides, and the smear it is shown there are normal and abnormal RBCs. Increased polychromasia, uh, multicolor RBCs, you can say in simple words, because there is premature RBC production from the bone marrow because of increased destruction. So you will see different colors of RBCs and containing different, then nucleated RBCs and target cells again. So this show the premature, the all these features are because of premature bone marrow response due to increased destruction of RBCs in the periphery. And then the erythrocyte sedimentation rate is low. Again, hemoglobin electrophoresis is a definite diagnostic test for this HBS, like sickle cell hemoglobin. In which will show you that HBS migrates slower than the hemoglobin A, so giving the diagnostic pattern of sickle cell hemoglobin pattern. So, what are the uh, crisis, the sickle cell crisis? You will come across these features, these words. What do you mean by sickle cell crisis? So you must know uh, ves- the responsibility, the responsible factors for the sickle cell crisis is, I already discussed with you, the pathophysiology, that there is stasis, decreased blood flow, stasis leading to thromboembolic phenomena, which will result in all these crises. So, vaso-occlusive crisis are symptomatic crisis. There can be hand and foot syndrome like dactylitis. They results in hand and foot swelling. Again, then bone crisis. You must understand that the vaso-occlusive process occurs normally in those arteries, in those vessels, like end arteries, and it can occur in all, but in small vessels, it occurs in small vessels. So, hand and foot swelling will occur. Bone, again, vaso-occlusive process in bone arteries will result in bone crisis, osteonecrosis, CNS crisis lead to because of thrombosis and bleeding. Pulmonary crisis will lead to dyspnea, severe hypoxemia. Priapism is abnormal erection of penis because of, again, the thromboembolic phenomena. And hematuria, uh, again, because of renal issues, because renal system is also having the end artery, so they lead to all these crises because of thromboembolic phenomena. And then intrahepatic vaso-occlusive crisis, splenic sequestration crisis due to pooling of large amount of blood in the spleen, which will result in splenomegaly and abdominal pain of sudden onset. So again, it's a very serious illness. Sometimes you end up with severe abdominal pain and splenomegaly because of this splenic sequestration crisis. So erythroblastopenia crisis, cessation of red cell production. Again, uh, it could be because of some bone marrow suppression because of other infections like any viral insult. Hyperhemolytic crisis. It is an unusual process in association with certain drugs or acute infections. So you must know all these features. And uh, organ dysfunction in terms of organ involves, as we already discussed. You can have central nervous system involvement. Acute infarction of brain will lead to motor disabilities, scissors, speech defects, and poor IQ. Cardiovascular system will lead to cardiomegaly, myocardial infarction, again lungs. The, if there is vaso-occlusive process in the lungs, you can have reduced oxygen saturation, reduced saturation, increased pulmonary shunting, and acute chest syndrome. So in kidneys, you can have the increased renal flow and increased GFR and enlargement of kidneys and proteinuria, nephrotics, and all these features. So then liver and biliary system, you can have hepatomegaly, cholelithiasis, in bones you can have dactylitis, avascular necrosis. So all these features these are because of the vaso-occlusive process, you will result in all these symptoms and all these clinical features. So in eyes, it will cause retinopathy, angioid streaks, hyphema, yes, blood in the anterior chamber. Ears, you can have sensorineural hearing loss, adenotonsillar hypertrophy, cutaneous ulcer of the legs. You can have genitourinary symptoms like priapism, abnormal continuous erection of the penis, growth and development by 2 to 6 years of age, height and weight of these children are delayed. They are compromised, and then delayed sex maturation, functional hyposplenism. So progressive fibrosis, which will lead to functional hyposplenism, and then hemostatic changes because of hypercoagulable states. So these are all features, and now how will you diagnose? Uh, in utero, you can diagnose the sickle cell anemia by doing PCR of as PCR. You can find out the DNA sequence from fetal fibroblast, which could be obtained from amniocentesis. A newborn, you can definitely diagnostic test is HB electrophoresis, which will find out the hemoglobin S. And the management, how will you manage this condition is you need comprehensive care. Uh, you need comprehensive care in terms of prevention of complications. You need prophylaxis for infections. You have to give pneumococcal vaccine and influenza vaccines. And early diagnosis of infection and management are the key features. So, treatment modality, anti-sickling therapy, you need fetal hemoglobin production stimulating agents um, like hydroxyureas, 5-azacitidine. Uh, so, again, most commonly used is hydroxyurea and recombinant erythropoietin and short chain organic acids. Again, you can use it because to increase the production of fetal hemoglobin. Red cell HbS concentration reducing agents like calcium channel blockers, membrane active agents, hemoglobin solubility increasing agents, and bone marrow transplantation. These are the key modalities of treatment. So, in this children, you also can go for like in case of severe hemolysis, you can also go for transfusion. Uh, uh, and in case of severe pain, like dactylitis, you need analgesics for severe pain. So all these are the treatment modalities available, but the definite treatment is bone marrow transplantation. Thank you so much.